Hello everyone, Jennilee here with a little anatomical insight on your hip and your knee. I'm going to talk a little bit about your internal external rotation here at the hip socket, which is a ball and socket joint. We usually have a lot of range of motion in the hip, but many people might not have that much range of motion. They might have the range of motion to do internal rotation, a turning in of the bone. I'm an internal rotator. And then some people have more range of motion coming out into external rotation in a bit of a cross-legged seated position or pigeon pose. So for those that do have the range of motion, they might find these external rotation poses a little bit more easier for them. And for others, like myself, we find the internal rotation actually, as if you were going into hero pose, a much easier configuration for the hip socket. So that's always good to know that it could be what's going on in your hip socket for internal, external rotation, why those poses are easy or hard for you. I also like to talk about the knee, which is a hinge joint. And it's really important to know that a hinge joint is flexion and extension. Okay, flexion and extension. When your knee is bent, there is internal and external rotation on some people. Some people have very little, this guy I think had very little, but very little range of motion, okay? Some people have a lot of internal and a lot of external rotation, okay? But some people have very little. So to come into hero pose, there's a little internal rotation happening here once the knee is bent. If you don't have that internal rotation, that pose might be very difficult for you, okay? So you can always just sit on your heels and stay with just immediate flexion versus adding the rotation at the knee. Know that for yourself. It also is for when you come into a bit of the eagle pose and you try to wrap your lower leg around. That's also a bit of the internal rotation, okay? External rotation. If you don't have it, these poses might not be the pose for you. There's always something else to do to actually support the stretching and strengthening of your muscles. Thank you so much for joining me today. A little anatomical insight on the hip and the knee.